I don't know how medical schools have turned a blind eye to the critical role that nutrition plays in your health. And people are shocked when they find out how little nutrition knowledge their doctor has. Their doctor's literally parroting what the USDA Dietary Guidelines for Americans says, which, oh yeah, by the way, the 2020 version of that is out. I'm going to do a little mini rant on that on the Ask Me Anything on Friday, so stay tuned for that at the very beginning of Friday's Jimmy Rants. But the new ones aren't any better, guys. And so if that's the protocol that the doctors are promoting for patients to get healthy, we know that it's going to bomb miserably. How do doctors sit by and year after year after year after year and see all these patients get sicker and sicker and sicker, more drugs, polypharmacy, and it just becomes this, that's a miserable feeling if you're a medical doctor. I could not imagine going to work and knowing you're not going to see people get better. And this is why when I interview doctors, which by the way, I'm interviewing Dr. Kristen Bear on the Living La Vida Low Carb show coming up a couple weeks from now. I think the interview is actually this Friday. I will interview her and then it will air in a few weeks. So look for that. But I interview so many of the keto, low carb, paleo, carnivore doctors, and almost every one of them says they have a spring in their step when they get up in the morning because they know they're going to get people off of insulin. They know they're going to see results that are making their patients more optimal. That's exciting, guys. I could not imagine being a medical professional wanting to make a difference in the world, which is why a lot of them got into the profession, only to see patients get worse and worse and worse every year. And it's all those lifestyle choices that they're making because they don't know what to do, and neither do the doctors until they become awakened. In our current healthcare system, physicians are burdened with time constraints that are imposed by hospital administrators and the insurance companies, as well as the pressure to be profitable. This is something people forget about. They just think, oh, doctor, rich. And they don't realize, oh, these doctors are basically slaves to a system. And the system demands certain things that are very highly unreasonable. And yet they're required to do it. And if they don't do it, they get dinged on their record. If they don't recommend a certain amount of medications in a month, they get dinged. If they don't, ICD code things correctly, they get dinged. I mean, there are so many things that if you knew what your doctor had to go through, you'd be like, oh my God, no wonder he doesn't have time to read the latest nutrition studies. No wonder they look so sad. Because they are sad. They're in a system that's broken, hopelessly broken, and they don't know how to get out of it. Treatment of metabolic syndrome and obesity becomes secondary to other quality control measures and comorbid conditions. So they're not even treating obesity directly. They're saying, oh, well, you're fat, so they don't say it that way, but I'm just cutting to the chase. You're fat, so that could explain why you have diabetes. You're fat, so you got heart disease. So lose a little weight, maybe that'll help with that. In the meantime, here's some drug, here's some insulin, here's some... And you see how they operate. And that's how it goes. Pharmaceuticals help treat the lab values. Listen to this line in Kristen's piece. Pharmaceutical drugs help treat the lab values and symptoms, but they often neglect the underlying cause. Think about all those people who take a statin medication to, quote, lower their cholesterol. And they take that medication and they think, because I'm taking this medication, I'm heart attack proof. And so if you think you're heart attack proof, you don't really care that you're having pasta, whole wheat pasta. It's healthy for you. You don't care that you're drinking orange juice for breakfast and having a banana. It's healthy. It's got a lot of sugar, but it's healthy. It's natural sugars. And so they give these pharmaceuticals, but they're not treating what's actually wrong. I think about all the diabetics who take blood sugar lowering and insulin modulating drugs. And the primary purpose of those drugs is to manage the carbs you're eating. Nobody tells these people, you don't need those drugs if you just cut your carbs down. How easy would that be? And that's what she's talking about here. Doctors are giving out these pharmaceuticals to treat the lab numbers. Oh, okay, well, I see the blood sugar in the range I want it to be now. Good job. Rather than, oh, okay, let's take you off the drug. Now let's see what's happening that's making your blood sugar go up. Oh, you're eating oatmeal for breakfast? Oh, wow. Why don't we remove the oatmeal and have some bacon and eggs instead? And that treats the root cause. These pharmaceuticals are merely a Band-Aid that doesn't stop the bleeding. It takes only minutes to order some tests and write up a prescription, maintaining the subpar standard of care. And oh my gosh, subpar standard of care. So the standard of care is doctors are required to do certain things if they see certain values on their patients' lab work. And so if they see a higher cholesterol level, standard of care, give them a statin. Oh, they see higher blood sugar or insulin levels, metformin and other diabetes medications, maybe some insulin, standard of care. So they're following meticulously this standard of care. And I love how Kristen describes it as subpar, because all of these so-called standard of cares, all they're doing is just covering up what the real problem is. Don't you want the doctor to get to the root cause of issues rather than just giving you this blasé answer because that's the textbook answer to everything? I do. This is why functional medicine has gotten a strong foothold in the medical world. This is why naturopaths and other people talking about nutritional health in conjunction with some medical care, they're growing as well. Mainstream doctors are not getting with the program. And I think they're going to be way left behind, other than a few to fix broken bones and to sew you up when you get cut. That's what they're good at. They're not good at chronic disease. Additionally, inadequate nutritional training, which I talked about earlier in medical school and residency, a lack of insurance reimbursement for lifestyle interventions, that's a big one. You want to know why your doctor doesn't spend a lot of time talking about nutrition? Well, number one, he doesn't know about it. But number two, there's no ICD code for a lifestyle intervention. And so if he even wanted to put you on a low-carb ketogenic diet, there's no ICD code. He won't get reimbursed, he or she. And so that's the problem. And it's all about making the money. They got to come up with the code that then the insurance will pay and keep the cash flow going. And again, you don't want it to come down to dollars, but it really comes down to dollars, guys. As much as we want to think healthcare is different, healthcare is supposed to be about the patient and making them healthy, reality check is still about money. And they're still going to do the things. This is why there's lots of procedures involved in medical care. I would argue a lot of unnecessary procedures involved. A lot of the open heart surgeries, they didn't need to go in and do all that. A lot of that could have been preventative had they just given the patient better advice early on. And the misleading epidemiological studies, and I've talked about many of those on here before, where they look at populations from various studies, and they say, well, we see across all of these very bad studies, we're going to make one very bad conclusion about these very bad studies. And they do that early and often. This is the so-called red meat will kill you. Cholesterol is the great enemy and it's going to clog your artery. And it's like they just make things up based on these epidemiological studies. It's horrible. All of this, from the lack of medical school nutrition training, lack of reimbursement from insurance for lifestyle intervention, and these misleading studies, all of those have resulted in very well-intentioned but highly flawed dietary guidelines, which again, 2020 dietary guidelines just came out. And I'm going to do a little mini rant at the beginning of Ask Me Anything on Friday, so don't miss that. This is added to the frustrations of lifestyle counseling in a medical setting, which is what Kristen and her coworkers in the Low Carb MD San Diego office are trying to do. They're trying to be lifestyle counselors for their patients because they've been awakened to the role that carbohydrates play in insulin and blood sugar and inflammation levels and all the rest. The Eat Less, Move More campaign has been an epic failure as it fails to address the endocrine adaptations and satiety mechanisms that are crucial for weight loss. This is something that they recognize and they know they get people on keto, they won't be as hungry. And yet if you tell people eat less, move more, what's that doing? It's going to make them hungry. They're not going to feel satiated. They're going to be weaker. It's a horrible, horrible advice. And yet it's still the advice that is the go-to for so many doctors. As a society, we have prioritized financial gains from the highly inflammatory processed foods. And I would include in there not just processed carbohydrates, but processed fats like the seed oils. Guys, if we really knew the cost of all those seed oils in just about every packaged food and even like deep frying stuff in seed oils, my God, how many years did I do that? And here's a funny thing. Once those fats are in your body, they actually come and become a part of your body. A lot of those old seed oil fats, I remember Dr. Kate Shanahan told me this in my interview with her last year. Once you eat seed oils and you keep eating them and you've got layers of body fat, guess what? There's some seed oils deep inside of there. So that as you lose weight, then those get released. And oh my God, so if you have elevations and inflammation from time to time as you're losing weight, that's what it is, guys. You're releasing a lot of those old seed oils. Nobody's talking about that. Nobody's talking about these highly processed, highly inflammable food-like disease agents, as I call them. We should instead be choosing nutrient-dense whole foods. And if we did that, that would improve the health of our country, which again is a well duh. Not once have they told us eat better food, eat real food, get sunshine, move all the things. They just haven't done it. So attempts are being made to address all these holes in the metabolic and obesity training. The American Board of Obesity Medicine has recognized the challenges that physicians face, and as a result, they created a certification focused on education pertaining to all the complexities of obesity management and all the associated comorbidities. I want to know why that hasn't happened before now. Now, I know this group, this American Board of Obesity Medicine. They used to be called the American Society of Bariatric Physicians, but I know them, and they have been focused on this. But they are a very small group of doctors in a very big sea of doctors. And unfortunately, until some of these bigger organizations get on board, it's not going to really go anywhere. The problem is all those other associations are heavily funded by pharmaceutical companies. You get big pharma out of the equation and metabolic health becomes a priority, with a low-carb ketogenic diet being the basis for every insulin-resistant patient. Starts tomorrow if you get the pharmaceutical industry out. The problem is the wolf's in the hen house, and the wolf's having a heyday. As one of the few specialty board certifications that does not require a long-distance residency, talking about this thing from the American Board of Obesity Medicine, it has gained popularity in recent years as the obesity epidemic continues to grow. From 1999 to 2000 through 2017, 2018, the prevalence of obesity, listen to the jump just in those about, it's like 18, 19 years. The obesity rate went from 30.5% in 1999-2000 to 42.4% 3 years ago. And the prevalence of severe obesity went from 4.7 and it basically doubled to 9.2. Clearly, we have a need for better management and education, but will this be enough to sufficiently address the obesity epidemic?